Over the course of the documentary, Dan transitioned from investigating his son's death to investigating a local pill mill in his community. We took a look at our own communities and discussed whether we see opioid misuse as a growing, neutral, or improving public health issue, and we also discussed how this issue is impacting our work as young pharmacists.
It actually makes my job harder. There are a lot of laws and regulations about the use of opioids and how you can dispense this medication. There are a lot of rules and regulations about how to determine if a prescription is right or wrong, or if it's a fake script. Sometimes you have these patients that come with some really high doses, and now you're thinking, is this patient really on this dose, or is this patient just trying to get high? At that point, it really makes my job harder because it puts me at a junction of trying to determine if this medication is safe for this patient or if it's ethically right to refuse to fill the prescription.
So let me touch on that first part of the question. I would say that opioid use is definitely at the early stage of the endemic ladder in Nigeria. And we have reported cases of its use by medical and non-medical professionals for non-medical use. And this has definitely been a threat. And like I said earlier, it's not exactly prioritized because there are more pressing endemic diseases, right? So opioid use is definitely on the rise, but it isn't at its peak just yet. It's still quite early.
Opioid addiction is considered as growing public health issue in Indian market. As of 2019, 2.5 million people have been found to use opioid for illicit purposes in north and northeastern states of India. Till now, opioid misuse has not significantly impacted my work during my internship or during my practice.
In my community, I consider opioid use to be a growing public health issue because its rate has increased over time. And then opioid misuse and addiction affects my work, or usually affects my work as a pharmacist, especially when I find myself in the community pharmacy setting. These drug abusers or these addicts usually resort to patronizing the drug dealers who would sell them these drugs willingly without a prescription. And because they do this because they know very well that pharmacists would not or are not willing to sell them drugs that are not written, these prescription drugs, without a prescription. So they tend to patronize these drug dealers, and this in turn frustrates our efforts to curb the menace, because while we are trying to minimize drug or reduce drug abuse, these dealers are promoting it.
Although opioid death rates are technically decreasing in the United States, I still see overdose and addiction as prominent issues in my community. Throughout COVID-19, we have seen some relapses with extended stay-at-home orders and support groups no longer being able to meet in person. So we have had to work on finding virtual harm reduction resources in order to support people who are in recovery but no longer can meet with their support systems in person.